Virtual reality a great tool for enhancing our vision of giving the best care for people who come to us. It was 4 decades now since we planned, Apollo started saying that we should bring world-class healthcare for our people. Today, people are looking at India and then saying, oh, India now has the best healthcare ever possible because we are able to, number one, have excellent training across the entire healthcare force. Yes, the doctor is very important in healthcare delivery, but there are a whole band of people, the superheroes who are supporting the nurse, the technologists, the managers, and all of these. Every one of them continuously has to be upgraded and say the patient's expectation continues to increase. And if you have to say that you can give the best health care possible for him, we need to adopt various things. This decade is providing us the tools for that. Digitization, artificial intelligence, now this virtual reality. I'm very pleased that 8chili CEO Arvind Upadhyaya, with what they have done with virtual reality, I think it is going to be a great fit for us to bring in the third element, with our digitization, artificial intelligence, in providing precise medicine for people, and more importantly, for continuous ongoing training of our entire healthcare force. This is where I think it will make a very significant impact in our intention of giving precision medicine for every single person who walks into Apollo, or for every person who asks advice from Apollo. Apollo is also known not only to treat patients, but to be able to train and advise the other, either the patient or the doctor groups, to exchange our views in giving the best possible precision medicine advice for patients. So I think this decade, as we all know, we saw a huge pandemic. The healthcare force across the world need admiration for the way they are tackling the COVID problem. But we have another one which has been recognized earlier, that is the non-communicable diseases. These non-communicable diseases is a great threat for the world. It has been recorded that by 2030, at the end of this decade, 80% of the deaths will be from non-communicable diseases. It's growing at a rate of 15 to 18%, each one of these major 5 diseases which were originally recognized as non-communicable diseases. The diabetes, the heart attacks, the strokes, infections, and now we are at the fifth one to the fifth and sixth and seventh is, that is obesity and then mental illness. These are going to be a huge challenge for us. This is where Apollo, when we are planning for delivering future health for us, we adopted digitization, we adopted artificial intelligence, and then now virtual reality. After seeing everything, 8chili provided from California, we heard the CEO Arvind Upadhyaya beautifully demonstrating what it can do for a doctor, what it can do for a patient, how can it train the various sectors of healthcare people. I think it's going to be a huge thing. That training is going to be a huge play that we need to develop during this decade. By end of this 2030, there are going to be 40 million additional healthcare workforce available. Even then, there is another requirement of almost 9 million left over. So I think adaptation of digitization, artificial intelligence, now the virtual reality will help us, give them the precision medicine delivery training possible, so that we will continue. At Apollo, our thing is not only to keep abreast of technology, but to keep abreast of living up to the patient's desire that I go to Apollo and I want to get, I know I will get the best possible care that's available for him anywhere in the world. This is where I think India and Indian healthcare will use the three major technologies that are available, and then virtual reality is going to play a significant role in our future healthcare delivery, in giving precision medicine to every single person who walks to us, or give the excellent training program for the entire healthcare workforce. I really want to congratulate 8chili, especially Arvind and his team, for the great work that they have done in developing virtual reality to this level, so that it could be a great addition in healthcare delivery across the world. And we at Apollo are very thrilled that we are partnering with Arvind in this program, and I'm sure we will come out living up to the expectations of people, that Apollo continuously upgrades itself. From day one, this is what we did. Brought the best possible technology, best possible skills clinical skills to the patient care. This is what I think today's our association with this metaverse, 8chili, it will be very, very important in health delivery system for the country and for the world. And I must add one more word. I think it is very necessary when handling non-communicable diseases to look at preventive health care. This is where Apollo has already developed. We have the largest experience in the world, having done over 25 million health checkups, and now using artificial intelligence develop ProHealth. And that ProHealth will find a great tool in using enabling virtual reality to add that power of making that individual to first prevent the disease and get a cure, then curing the illness. So this is where I think preventive care also will play a significant role, and this virtual reality will play a great role in enabling both the patient as well as the institution. God bless all. God bless. I love you all.
Thank you very much, sir, and thank you for laying out the vision of where AR and VR and the metaverse can take us in safer quality healthcare delivery in our country and beyond. With that, we'd like to open this session now for Q&As. I do have a few questions that have come in already. I request Mr. Prasad Rao, who's raised his hand, to please identify his publication and the question, please. Mr. Prasad Rao? Okay, while we wait for him, I have a question from Mr. Rangaswamy. He's asking whether AIMS in the country have developed the metaverse version. Arvind, would you have any insights on that?
Arvind, you're on mute.
Yeah, so no, this is the first deployment on this scale that we are doing. So there have been institutions abroad who have done it. We have some partners, but it's the first of its kind that we are doing in India. There are some bits that people would have done, but I think like what we talked from an end-to-end perspective in the care continuum, it's the first time that it's being done.
Right. Just adding on to that is a related question from Narayanan of the Hindu Business Line. Navin, he asks, what is the nature of this partnership and which are the treatment areas that we are looking to collaborate in?
To answer that, we're starting with patient engagement, engaging the patient Dr. Pratap Reddy mentioned is quite critical, especially in today's day and age wherein we have everyone having their own thoughts about what their condition is from Google or WebMD. So we want to bring in that the access to more informed consent to the patient, wherein they can understand their clinical pathway, their procedural pathway, and that's the pre-op part. But then post-operative, there's a huge market, especially which is post-operative insomnia that patients suffer from pain therapy or pain management. So we are delivering, VR for pre-op and post-op. And then eventually, like I showed in the video, so there is a part which is helping the surgeons do pre-operative planning. So when a surgeon does the pre-operative planning in 3D, they're able to see or visualize the soft tissues, the trajectories, the heart, the bones, wherever they are. So it kind of gives them the perspective that, they are going very well prepared. It's like a warm-up that an athlete does before they go on to the sprint. This is exactly what the platform will allow. And that same plan that the surgeon has created in virtual reality can then also go into the operating room itself. The OR is like, every minute of the OR is precious. So we would like to save that precious time of a surgeon by delivering them critical insights, by bringing in augmented reality, by overlaying this critical information on the patient. So some of this work is still like, in the pre-FDA process, but I think, with the investigation use only, that's the piece that we are working with the tool. And like I said, last but not least, like what, Dr. Sangeeta already mentioned, training is a critical component as well. There has been, studies globally that prove that training in virtual reality is far more effective. So we are bringing an original content creation platform to Apollo, and the opportunity to like create the world's largest, like let's say, database of 3D training material that can be used globally. So that's what the entire partnership is about.
So Karan, just to add on to what Arvind said, 8chili is the technology part of the platform and they are the technology gurus. While Apollo brings the clinical expertise to it and the entire clinical content to it. So it's a perfect marriage between technology and the clinical content part of it, and Medversity, which is a part of Apollo, would be developing the clinical content which is essential for this platform and will enhance the utility of the platform both in terms of the patients, the community and the medical professionals, either in training or in actually treating a patient. I think that explains the relationship better in terms of what 8chili is doing with Apollo.
Thank you for that. That was Dr. Hari Prasad who gave the insight of how this collaboration will work and how this will impact patients and also training and upskilling of our workforce. Are there any other questions in open house? We can take any questions if you have. Otherwise, the press release for this event will be in your inboxes as soon as this event is drawn to a close. Our contact details are also there in the press release for you to reach out to us for any other information or insights that you would like on this collaboration. So do feel free to reach out to us. One last round of calls for any questions that you may have. Otherwise, we'll draw proceedings to a close here. I don't see any other questions, so I would like to thank the members of the press who have taken time out today to be here in such large numbers to hear us speak and talk about this new innovation that we are bringing into healthcare. My special thanks to our chairman, Dr. Pratap Reddy. So thank you very much for taking time out and being here this morning. Dr. Sangeeta Reddy, ma'am, thank you very much for being here and laying out the vision for what this collaboration will do. Dr. Hari Prasad, so thank you for being here and encouraging us to do more. Arvind, thank you for your presentation and also for showcasing to us what this would look like in the real world. And with that, we bring proceedings to a close. Have a wonderful day ahead. Thank you.
Thank you.